Greetings, everyone, and welcome to the Digital Dental Podcast. My name is Neil DeMasier, and this is the podcast where we talk about all things digital dentistry, from milling to 3D printing to computer-aided design and so much more. I'm super pleased today to have as my guest on the show retired Navy Captain, Dr. Prosthodontist, and all-around super nice guy, Peter Barndt. Peter, welcome to the show.
Thanks for having me, Neil.
It's a pleasure to have you on. I've been planning this for a while, actually, because we've known each other for some time, but never actually just kind of got around to it. So I'm really glad that we're here today, and I appreciate you hosting me up here at your beautiful practice here in Burlington, Vermont. Where they got the great mountains in the background there. Hopefully, everybody at home can see that. For those watching the video, that is. For those listening, you'll just have to imagine them. They're mountains here in Vermont. So yeah, lots to unpack with you and lots to talk about. I guess maybe where we get started is, I mentioned a moment ago that you're a retired captain from the U.S. Navy, and in that time, and you're, I think it was what, 20 years in the Navy,
20 years.
which
Yep.
we appreciate your service, of course. You were the very first digital dentistry specialty leader for the United States Navy. And we had your successor, Captain Trey Harper, on the podcast a while ago, and he had a lot of interesting things to say. But I wanted to get it from your angle. Which, am I correct in that? Were you the very first?
So there were two.
There were.
Yep. The way it happened was they basically knew there was like a need to solve, and that need was like, how do we improve like access to single crowns, like
Yeah.
laboratory services were challenged.
Yeah.
So it was at the time it was Commander Steve Sturlitz
Mhm.
and myself, and Steve was more like angled on the giant building the giant like SIC community,
Okay.
and my task was like figure out the lab world, which was like there was no one solution there,
Right.
and we kind of had to like do research and figure that out. And then Steve and I together like tried to build up like CEREC utilization, and then kind of taking like the OmniCam
Yeah.
or the Prime Scan, and eventually just turning it into an intraoral scanner to feed the laboratory system, which I know like now sounds like,
So
of
obvious.
course,
Right.
yes, but at the time that was a battle, and we had to like bargain with Sorona to
Yeah.
get like STL export, which they didn't offer
Because
at
there was
that
a
time.
completely closed system at the
Yeah.
time. So it's like if you scanned with that, you had to stay in that workflow,
Yeah.
and there was no way out.
Seems so foreign now
Yeah.
that, but yeah, it was totally sealed up. So
Yeah.
that was like a big deal for us to like get that breakthrough.
Nice.
So yeah, and then I had to just travel. Lab day was an awesome place to do research,
Mhm.
and I just had like great connections in the lab world. Like Nick Azera with Bago,
Oh, yeah.
you guys, like people that could like take me around to laboratories who were already on that digital march, already like super digital in their processes, and I could see what they were doing, and then try to like pattern the Navy
Right.
after like the best practices I saw.
Like, what were some of those best practices? Like, what did you see? Were there anything that like sticks out in your mind? I know this was a while ago, but like
Yeah.
that you saw and you were like, "Oh wow, that's a great idea. I'm gonna implement that in the Navy."
Well, there's like, so there, yeah, some of these things just show you like, I guess, how old I am. Is that like one of the things I saw that was like a big deal back in like 2012, where was like basically people are still submitting traditional impressions and triple tray impressions.
Mhm.
And how do you digitize those, right? Without necessarily like creating a model and then scanning
Right.
that, like pouring a cast and going through that process.
Yeah.
So like one of the big things I saw was like, oh, there's a lab that's like scanning triple trays and going completely digital and
Yeah.
with no physical cast. And so that was like one of the moments where I was lucky to have access to see the people doing that, and
Yeah.
then try to like build the Navy in that kind of pursuit.
Yeah. Yeah. Well, it must have been a pretty cool time because it was kind of right at that time when things were, starting to open up. Like I feel like if you went to Dance Place Serona, whatever, a few years earlier, there wouldn't have been any way they would have opened that up. But it's like I think they kind of saw the direction things were going with open, open format, industry standard format. you know?
Totally. I think you're totally right. I remember we were at a big dental meeting, and Steve and I had the chance to like go in and make our sales pitch to the leadership of Dentsply Sirona, and they're just like, okay, and like when we made the ask,
Like,
and
"Is
so clearly
it that easy?"
they yeah, it wasn't that we were that good at
Yeah.
pitching our case. I think, like you said, they already had it in mind. They
Yeah,
knew the like direction
yeah.
the industry was going. So yeah, so it was an anticlimactic yes.
But hey, it's a win.
Yeah. Yeah.
So yeah, so you had that win. Um, you're kind of I know you hate anybody tooting your horn, but like you're kind of well known throughout Navy and military dentistry as like the guy who brought exocad to the military. Like how
Okay.
did that all go down, you know?
Yep. No, so that's a really good question. I definitely, I just happen to be the person that was like
Right
at
place,
the,
right
the
time.
the first one. So
Yeah.
whoever gets to go first then
Yeah.
gets to, yeah, like I'm not gonna claim that title or anything. But so the thing that really drove us to exocad was a lot of our interaction with Imagine. So it was actually an Ivoclar laboratory rep for us coming to Bethesda, and we were, on the hunt for like, okay, we want to have lab technology and we want to do in-house milling.
Right.
And he's like, yeah. And then we said, well, we really want to make implant parts. We're frustrated with like the results we get by submitting to large services that insist on designing the custom abutment themselves.
Yep.
They don't design it the way we want.
Yep.
And there's limitations on their blank, right? There's like all those things as
Yeah.
a
All these
prosthodontist,
restrictions.
yeah, that you're
Yeah.
just like, I just want to make my own part,
Yeah.
right? Like,
Yeah.
why can't I just go right to it?
Right.
And so this Ivoclar gentleman directed us to Imagine. He said, "Oh, there's this company out in Chantilly. You should talk to them,
Uh,
right?" And so my initial thought was like, I never heard of them.
right.
Okay, but we made a field trip out there, and then that just like kind of unlocked our world. So we had already been using exocad a little bit,
Okay.
but we were using it through a different reseller
Mm.
who had a wrapper on it.
Oh yeah.
And basically, like the implant side of it was very locked down. And so Felix Chung was the one that like kind of like
Yeah.
blew that up and was like, "Oh, well,
Oh,
you guys haven't been using Open
yeah.
exocad,
Yeah.
right?"
Yeah,
And
but it
then
doesn't have to be that way.
yeah,
You know,
and so then we, on the tour of Imagine at the time, then we discover the world of Hyperdent
Mhm.
paired with exocad,
Mhm.
right? And what we could really do for implant manufacturing, whether it's utilizing tie bases or going to abutment or implant level.
Yep.
And that was like the thing we were after like the
Yeah.
whole time.
Yep.
And so that really like shoved us off, I think, on the journey with Imagine
Yeah.
and your technical solutions like first in the implant world.
Right.
Yeah.
Right. Yeah. Yeah. It makes sense. And that was what, 2000?
It was like 12. Yeah.
Really? Yeah.
Yep.
Wow. Time flies, right?
Yeah. Yeah, maybe 2013. Yeah.
Yeah.
Yep.
Somewhere around
Yep.
there.
Yep.
Somewhere around there. So, so yeah. So I mean, yeah. Time flies. You've kind of finished up your career with the military. You found a great place to land up here in Burlington, Vermont. Um, I'm sure it's been quite a transition to be in the military for 2 decades,
Mhm.
right? And then come into, private practice and, it's gotta be, I mean, you're doing the same thing, but you're just doing it in a different way or doing it like help me understand that. How has that
Yeah.
transition been?
Yeah. So okay. So I knew this question was gonna come. And this is a complex question. So the first thing is I for a long time I had used like my own digital workflow and had a lot of experience like we did everything in-house, right? Maybe with the exception of like in the occasional full arch that came by, right?
Sure.
We might ask someone else to help us make the definitive restoration, but otherwise we made everything ourselves.
Yeah.
And so I wanted to bring that capability to private practice, and I wanted to do it on a platform that like, was all the equipment that I'm accustomed to using.
Sure.
So basically I duplicated my setup within the military in private practice, and I was lucky enough that like my practice owner, Tara Hopkins, was like willing to like support me in
Yeah.
that.
Yeah.
But I felt like that's like a really important part is that like whatever a patient needs when they need it tomorrow,
Yeah.
I'm like, yeah, we can do that. You broke your full arch implant prosthesis. I can, mill PMMA,
Yep.
and in 24 hours you're like back to as you were or better. And
Yeah.
so so that was a big part of it. But then the other component I think that's maybe been one of the harder adjustments is the average age of my patient probably went from being,
Oh,
30,
right.
25, very unremarkable medical history, right?
Right.
To very complex medical histories.
Yeah.
Average age of the patients now probably more like 65, 70, right?
Yeah.
And also the mouse clicking is much more extensive. So instead of you're designing 6, 8 teeth, maybe the occasional full mouth rehab,
Yeah.
now it's like every time, you're trying to place 28 teeth. And like, so definitely learning ways to like gain efficiency
Mm.
and deal with just like larger scope of project.
Right.
And then I think the other, just I don't know, the real reality of being a prosthodontist in the civilian world is you're just meeting a lot of people at the end of their dental journey,
Mm.
and there's like an amalgamation of dentistry,
Right.
4 different kinds of implants in their mouth. Some of them are failing,
Yeah.
they're in bad positions, and
Yeah.
it's just like, yeah, bring all that together and make it work.
Yeah.
Right.
Man, that's heavy because like four
So
different types of implants probably means, four different surgeons placed it. So
yeah,
you got like, whatever, four, half a dozen different doctors work in there,
yeah,
and then it
yeah.
all just presents to you, and you're like, okay,
Yeah.
yeah,
And then just to like sort of like cap off this point and as like I guess a nice tip of the cap to military dentistry,
mm,
right? Because I know there's lots of ideas of like what goes on in military dentistry, but the one thing that's so hard for me to do in the private sector is like when I need to like kind of like put the brakes on my chase of ideal,
mm,
because
mhm,
now there's a dollar amount
right,
that comes with that.
right,
And so there were so many times in the military where, you'd be, maybe you're doing an implant and a full coverage crown, and next to it is, an MOD amalgam. And you're like, "Oh, just like, you okay if I do this? Like,
yeah,
we'll do a nice inlay or onlay for you here." And the patient's like, "Awesome, do it."
right,
Right. And they feel like they're getting really good benefit.
right,
And now I have, that additional element of your treatment plan is like a substantial increase in cost.
right,
And
right,
so it's just a different way to approach it. And like definitely you get to work as like a perfectionist
mm-hmm,
in the
yep,
military.
yeah,
And I love it for that reason. And it's like such an awesome way to get experience as a prosthodontist. So
yeah,
I'm saying it more as a positive for military practice and particular like prosthodontics.
yeah, right. I mean, yeah, right. For better or for worse, like whatever the cost is of that procedure for somebody in the military, that's just covered. That's part of them being in the
Yeah,
military, right?
it's like one of their greatest
It's
benefits.
one of the perks,
Yeah,
right?
yeah, yeah.
But yeah, coming out that goes from, hey, do you want me to do this? Sure, to like, hey, here's this thing. It's going to be this much money. Breaking it all down and having to help them understand and
Yeah,
figure out, is it worth it?
totally. And then, like, I mean, the care we provide, that I provide now in private practice, it's expensive. Like, I totally understand that,
Yeah.
and just being like very fiscally minded for the
Mhm.
patient,
Mhm.
and try, if they have a certain amount they can afford to invest in their mouth, like trying to like be really targeted with that
Yeah.
and get the best bang for their buck for what they are willing to invest.
Yeah. Yeah. Which yeah, that must have been a tricky transition to make,
Mhm. Still going
Still
on.
going
Yeah.
on.
Yep.
But I'm sure there's gonna be people listening to this that like are happy to hear that because there's a lot of military dentists getting out all the time for a variety of reasons, right?
Yep.
So they all have to make that transition.
Yep.
So yeah, I can see where that would be. Yeah. Oh, take a little bit of
Mhm.
time.
Mhm.
So yeah, you're also kind of known for your presenting. You've done a lot of presenting and lecturing, a little bit for Keystone Implants. You've done some for Imagine. probably, a ton more in the military. I had the good fortune of seeing one of your lectures just a month ago out in Colorado, which was great. Um, Help me understand from somebody like it seems to come naturally for you. Like, was it always? Is it as comfortable as it looks for you to be up there talking to these people? And if it's not, like, how did you get there? And like, what's the best way, or what are some tips that people can use when it comes to training on whether it's on digital dentistry, exocad, or something else? Like, how do you get in that comfort zone?
Okay. It's a great question. I haven't really thought about that. So I'm sure people who know me, I'm very like introverted.
Yeah. Yeah.
And I don't know what it is about like the presenting technical things, but for some reason that comes easier. So I think definitely as you go through a prosthodontics residency,
Mm.
it was a big deal at UConn to be like very polished as a presenter. And like it was, I guess our senior residents kind of presented it to us as like, this is the way you make your mark in the world
Mm.
as sort of, a subject matter expert. You need to be articulate. You need to be good at, delivering a presentation. So they were the ones like pushing us as
Yeah.
like young first year pros residents.
Yep.
And then also like experiences like preparing for like Northeast Implant Symposium, venues like that is just like, I don't know, you just put, I feel like if you put a lot of work into your preparation and your material, then it's easy to tell the story.
Right.
I think along the way, I also was like presenting and got on board with Keynote early on.
Yeah.
Like, so going to like ACP or AAFP presentations and like early Keynote users, everyone was like, oh, like those are amazing graphics and like
Yeah.
just super clean
So much better than
presentations.
PowerPoint.
Yep. And then initially, I think
It
that's
kind of
like,
leveled
yeah,
out now.
leveled out.
Yeah.
But initially, Keynote was a big deal.
Yeah.
And then the other thing was like Steve Jobs and his whole like presentation style.
Mm.
I sort of like, I guess as an Apple Keynote user, I paid attention to that.
Okay.
And so his big thing was like no text, right?
Ah.
And so I've always tried to like build presentations that way of like the whatever's on the screen
Yeah.
is like helping me tell the story.
Right.
And so I don't have to like, have a written narrative or anything.
Yeah.
It's just like the everything that goes on the screen is my prompt.
Hmm.
And of course I know the story because it's like, technical dentistry or it's the patient I treated or
Yeah.
whatever.
Yeah.
And so the way to like, it's like kind of flipping the pages of a book, going
Hmm.
from one slide to another,
Hmm.
and just trying to tell that story. And I think in general, like people are more entertained with
Oh yeah.
photographs than bullets
Yeah.
and
Oh yeah.
yeah. So
Yeah.
that's probably I guess how I arrived at the style I try to use,
Sure.
which of course now is like super widespread, right? Like that evolution
Yeah.
sort of occurred, I think, in dentistry.
Yeah.
Like, um,
But not everybody does it well, and people can try the no text thing, but it's like, it takes a certain level of comfort and humility and humor. That's one thing that I always try to any presentations I do. I always try to integrate some humor in there, to break
mhm.
it up. I noticed a couple things that you did there as well in the one that I saw. The launching the
Well,
implant from the
yeah, from a
aircraft
cruiser or
carrier.
something. Yeah. Yeah. I mean, I think all dentists know the practice of dentistry is very humbling, right? You think you're on top of your game. Wait a day, right? And tomorrow will teach you a lesson.
Yeah.
And so I also try to present from that vantage point of like, I dentistry is tough and like I don't want to ever pretend like the things I'm showing were like, oh, that just like falls into the patient's lap, right? Like
Right.
everything is a challenge to like stick to your workflow and the details and like
Hmm.
kind of persevere
Yeah.
through the challenges.
Yeah.
So maybe that is part of the style is like I can admit it's hard
Yeah.
to do things the way you want.
Yeah.
So
And probably, providers that are in the audience listening to that probably take a lot of comfort in hearing that, like, oh, it's not just me that it's
yeah,
hard for.
yeah,
I'm
no,
not the only one who has these struggles.
yeah, yeah. I mean, it's super frustrating to be like, I've been doing this 20 years and like I could be humbled in any
Mhm.
one moment,
Mhm.
right? And certainly now in the private practice world where like you're just dealing with things of more complexity, more just more variables. It's just like waiting to teach you a lesson. So
Yeah.
yeah.
You learn something new every day. That's what they
Hmm.
say, right?
Hmm. Hmm.
So speaking of learning, so you mentioned UConn, University of Connecticut, a moment
Hmm.
ago. But I happen to know you went, I forget where, but you got a bachelor's of science in mechanical engineering before you went to UConn for dentistry. Is that right?
Yeah, that's true. So I went to Virginia Tech. So
Yeah.
I grew as a Virginia kid, and so that was an easy fit
Yeah.
going to Virginia Tech. And that was engineering was like kind of just I don't know my it was always my backup plan. I enjoyed it. My father was an aerospace engineer, so it was like kind of one of those things. It's like predetermined
Right.
that like well you're gonna do engineering,
Yeah.
and then you can decide what you do after.
You got
But
it.
then these are the weird things that like things happen in life and you feel like your career path was like meant to be.
Right.
But so part of applying to dental school is you need to shadow and like get experience in dental practices. So
Mhm.
just a couple blocks away from my apartment in Blacksburg was a dentist who happened to be a gentleman who was on the leading edge of dental implants and like prided himself that way. And so in his office, I got basically I learned about IMZ implants, which is like one of the original systems.
Wow.
And they had this like what they felt like was a very clever solution is they used a Delrin, like a polymer, intermediate abutment that they felt would function like a PDL or like give the restoration like shock absorbing
Right.
capability.
Right. Yeah.
And what
Conceptually, not a bad
Right.
idea,
Not
right?
not a bad idea, but unfortunately, like, it doesn't allow you to clamp parts together
Oh.
because, like, of that it's like a gasket that's, like,
Yeah.
too thick,
Yeah.
right?
Yeah. Yeah.
And so you could put those parts in with whatever preload they could stand, right, trying to, like, clamp them,
Yeah.
but ultimately those polymer screws would break, and when they broke, it would be the threaded portion still stuck in the implant for him to retrieve. So that became, like, my senior engineering project, and they broke so frequently
Yeah.
that I got to like test my prototype tool like in his office.
No way.
Yeah, so it was like that whole experience. There was basically no way I could avoid being a prosthodontist, I think, on the other end of dental school.
Right.
So,
Right.
yep.
Yeah, so that's kind of how the whatever the path led to dentistry was just like that time. The time you spent interning at that place,
Right.
dentistry.
Yeah, and then I mean, and the other, I guess the other thing about engineering is like I feel like it's like so all the disciplines of engineering are really well suited to dentistry.
Mm.
And I know there's a lot of other backgrounds that are probably they all have unique angles in
Mhm.
terms of like how you approach the practice of dentistry, but I do think an engineering background, like the materials background, like understanding, definitely like with implants, like the way things get assembled,
Yeah.
and just stresses. Like the mouth is a super complex
Mhm.
biomechanical machine,
Mhm.
and so engineering is like a nice fit, and particularly for prosthodontics, I think that like gives you like I don't know, you need background on things that can
Yeah, I mean, I
help
have
you solve
to
problems.
believe that it gives you it informs your decision making from a perspective that a provider without that degree, wouldn't intuitively go to that, place.
I I think so. I guess maybe like it's probably scientists, engineers. I feel like a lot of what we do in prosthodontics is you're looking at failures
Mm.
and then you're trying to like engineer your way, like understand why it failed,
Right.
how it failed,
Right.
and avoiding that in whatever you do to restore the patient,
Right.
right?
Right.
And so that's very much like that pursuit is like an engineering mindset, right?
Yeah.
Is like the diagnosis of the failure, which a lot of times can be like mechanical in nature. I think when we're dealing with like, large scale tooth replacement.
Yeah. It's a good portion of the time. If you just think about, I mean, like you said, it's a complex system to begin with, and just like the forces involved can be very significant, right? I mean, I forget, I mean, you probably know the numbers off the top of your head, but like how much force when you're fully biting down as hard as you can, like a tremendous amount of force.
Totally. And
Yeah.
that's another aspect of engineering applied to dentistry is
Yeah.
like being that I feel like uniquely equipped me to do is like meeting the patient and quickly identifying like risk factors, right? Like
Mm,
based on their skeletal relationship and things like that. Like, oh, this is like a high force patient. This is a patient who's gonna like I have to use the best materials. I
right.
have to over engineer, build factors of safety, all those kinds of
Right.
things. So
Right.
yeah.
Hmm. Yeah. I mean, I don't know. Have you ever met another prosthodontist who had a BS in mechanical engineering background?
I have.
Have you?
Yeah, yeah. There's
Can we run the
several.
event?
Yeah. No, I've met like UConn actually just had another mechanical engineer, Greg Tao, who is like, yeah, the same, like basically in a very similar way, like quickly like dives into the CAD CAM world and
Yep.
like just like eats that up.
Yeah.
And yeah, so I think it's like it's a hard to there's like a gravity to pros that if
Mhm.
you're an engineer, like
Mhm.
it's inevitable. You're just going to be pulled
Yeah.
into
If
prosthodontics.
you're an
Yeah.
actual engineer, or just even just engineering minded, and you're moving towards a career in dentistry,
Yeah.
you're
Yeah.
gonna end up a
You might as well just give up.
yeah.
Yeah. You're a prosthodontist. It's already been determined.
Congratulations.
Yeah. Yeah. Yeah.
So, so yes, we've been talking a lot about kind of like your history, your background, kind of what you've done. But I mean, this is the Digital Dental Podcast, so let's talk a little bit about. You mentioned earlier when you came to this practice, you were able to kind of copy paste the system that you had within the military here
Mhm.
in your practice. So unpack that for us a little bit. What is your CAD/CAM system? What's your protocol? Like, what do you use and how do you use it?
Yep. So dating back to those original days of like system building in the Navy, so we always were intimately tied with Dentsply Sirona because of the CEREC system.
Yep.
So for a long time, I've used the Prime Scan. I really respect that scanner,
Yeah.
and also in private practice, like using the Prime Scan to like for patient education, like the
Yeah.
huge touch screen, all that is really nice. So the Prime Scan is my starting point
Mhm.
of everything digital. And then I've been lucky enough, like working with you guys, and now that I can, make my own decisions about equipment.
Right.
Certainly, we have a cone beam in our office, so that's an important data point. And then I've been lucky enough to add recently Ray Face.
Mm.
So that's always been a frustration of mine. Is like, using we've always used photographs in exocad and you can do a lot
Yep.
with like 2D planing,
Yep.
but now being able to go to like that 3D world, especially for patients that are edentulous, that is like
Right.
a great leg up on like your diagnosis and planning. And then also new to our clinic is a device like ModJaw.
Mm.
So that is also like, mind blowing information
Yeah.
and diagnostic capability. And I'm just like starting to get into that. But that's like all the elements of like
The
the
data
digital patient.
acquisition.
Yeah.
Yeah. Yeah.
Yeah. Building that digital patient. And then it all rolls into exocad,
Mhm.
and so that's like my indispensable like
Right.
treatment planning tool.
Yeah. Do you
And
do you like when it comes to like treatment planning, and you mentioned for kind of show and tell, or interacting with the patient, are you using these, screens and software and digital tools with every patient, every case, or is it just the really complex concepts that you're trying to convey? Or
yeah, no, it's a great question. So there, I think maybe if it's a single posterior tooth, there's still going to be like we're still going to capture an intraoral scan, a cone beam. If
Mhm.
they were missing a tooth, like I'll chase guided surgery every single time, right,
Mhm.
for predictability. And we'll still have a digital wax up, even if it's just like missing, first molar. Like we're gonna digitally wax that up and work it all the way up and have a surgical guide. But I think when you get into the 2D planning, the 3D planning, for anterior like cosmetic things or just larger prosthetic rehabilitation,
Mhm.
then that's where like it really gets uh deeper or bigger in scope.
Yeah.
But I'm in exocad for every single patient. And I feel like one of the things I've learned in residency is like every time you think like, oh, this is simple. I don't need to like I don't need to do the wax up. I can skip that step. I can those are the times you get burned. So so yeah, so we're very like dogmatic that way, and that like, okay, we're gonna do this process every time.
Mhm.
And it's so efficient that like once you get in the habit,
Yeah.
it doesn't slow you down. So we'll do that whatever kind of digital prototype like blueprint we need to
Mhm.
develop,
Mhm.
and then we'll take that into the cone beam world and do our surgical planning,
Yeah.
so we can have that like restoratively driven kind of like space oriented
Yeah, yeah, yeah.
approach to implant positioning.
Yeah. And that's any of the cases where, the patient is presenting without the implant already there, you have that protocols kind of set where it's like, okay, it's going to be guided, it's going to be digitally planned. That way it can be prosthetically driven, which has got to be such a breath of fresh air compared to, just patient presenting with XYZ implant and some crazy angle that you
Hmm.
just like, here, deal with this,
Yeah, no,
clean
totally.
this mess up.
Yeah, totally. I think another thing that like I think it has been a little bit challenging to like you have to break in new surgical partners, right?
Mhm.
In wherever you move, whether it's in the military or the private world. And the one challenge is like a lot of surgeons who are particularly experienced think like, what is guided surgery going to add
Right.
for me? Like I can put in the implant with very good alignment.
Mhm.
I've done this a long time, right?
Right.
But a couple variables I feel like that like I've really liked the control of like digital planning and doing guided for every single instance. One is just recognizing like deficiencies. So like
Mhm.
when the patient has lost bone and has like a defective alveolus, like that
Mhm.
gets diagnosed and built into the surgical planning,
Right.
and sort of like quantified as well.
Right.
Like you know how many millimeters,
Yeah.
right, you
Yeah.
need to add, which can shape a treatment plan. And then the other thing that just is hard to get surgeons to like initially to buy into is the control of depth of
Mhm.
the implant,
Mhm.
right? So even if you were maybe guiding like the initial creation of an osteotomy, like I want the implant like delivered through the guide
Mhm.
to the depth that
Mhm.
like it was planned, so we have emergence. And I think we're finding out like more and more how important emergence is,
Right.
the angle of that emergence to like prevent future peri-implantitis, or it's like, I mean, it's basically become a risk factor
Oh, has it?
for bone
I
loss.
hadn't
Yep.
heard about that.
Yeah, I mean, I think they're building that data set, but like you can find like conclusions like that
Mm.
or references like that. And so that's, I think depth is big for that reason. It's also big for just making sure like you have enough room
Yeah.
to
Storage.
stack all the components you need and not have them biting on a screw head,
Yeah.
right? So that's all like I think I really like knowing that like if we design it all on the computer, we can like go to the mouth, execute that plan.
Mm.
There's no surprises, and all the involved parties, surgical, restorative, feel
Yeah.
good about like what happened at the end of the day.
Yeah.
Um, and then, so sorry to wrap up your question about like what is that package
Yeah.
of equipment.
Yeah. Yeah.
So coming out the back end, the other really important piece to me was a 5-axis mill.
Mm.
So I tell people all the time I was like a spoiled brat. I've always
Got all the
had a
toys.
yeah. I've always, I mean, of all the pieces, I think you know intraoral scanner, exocad, 5-axis mill, like couldn't be a prosthodontist without that grouping.
Yep.
And the reason for that is just the ability to like turn around projects quickly, but also like once you get good, I think once you have experience with hyperdent, and just being involved in that manufacturing steps, there's things I do when I mill my restorations to like preserve the fidelity of the design I had in exocad, like sprue
Oh,
locations,
sure.
the way it's the angle it's nested, all those kinds of things.
Mm-hmm.
And just that level of control. Not that I'm a control freak, but like
Proselytize never.
when you have that process start to finish, that is awesome. And then
Yeah.
I think the other piece is like adhesive dentistry. So whether instead of, it's again not a new concept, but like instead of doing a traditional full coverage crown, doing things that are more conservative with two structure, but
Mm.
sometimes are hard to like maintain provisionals on. So that's like where the CEREC world is like, well, we just bang it out in, an hour and a half.
Mhm.
But having an in-house 5-axis mill gives me like the highest quality indirect restoration, right? Like so precisely milled, and I can have it the next day,
Yeah.
right?
Yeah.
And I think it's creeping towards like I might be able to have it in an hour
Yeah.
as sintering like speeds up faster and faster.
Yep.
But that is, I can settle for next day to have like the quality and also the aesthetics of like
Yeah.
the zirconia centered, on an 8-hour cycle, and we know that that's going to be more aesthetic
Oh.
result than a 1-hour cycle
Mhm.
or a 30-minute cycle. So anyway, so that's like an important piece of my workflow, and
Mhm.
then this, of course, 3D printing,
Yeah.
so important for like being able to like execute mock-ups. We do a lot of our own aligners. So all those things just like roll in-house. I've now that I'm in a civilian private like
Yeah.
prosthodontic practice,
Yeah.
now complete dentures. So out of
Oh,
my
yeah.
Form 4B,
Yep.
I those are like an awesome product.
So you're
Whether
doing printed base and teeth.
printed base and
Yeah.
teeth.
Okay.
Yep. And I wouldn't say that like I have I have patients that are using that as a definitive restoration with the understanding of like when it comes time, we'll just print another,
Right.
right?
Right.
And then but then other times we'll access milled solutions for dentures as well.
Mm.
But just to like have an initial prototype, particularly on patients that might be more challenging denture patients,
Right.
it is just so quick and financially efficient
Yeah.
to be able to 3D print that denture, and they fit amazing. Like there's almost like I don't have to use pressure paste
Nice.
at delivery if you've like put in your time with your impression method.
Mhm.
Um, and so that's another avenue of printing. I guess the one area I'm like dragging on because I've always had a 5-axis mill
Yeah.
is everything implant. I just prefer milled PMMA
Mm.
as my like interim solution rather than printed crown bridge material or
Right.
those kinds of solutions. So
Yeah. Well, it's kind of like you were talking about earlier, right? Like you define the process, and when you know it works, as long as it's efficient, you just follow the process. The process is the boss. You're just following the process, right? So it's like, why, unless there's a problem with milled PMNA provisionals on top of a tie base, like why would you stray from that? You know?
yeah, and I guess the other things in that respect is kind of meeting patients in the middle financially
Mm.
is milled PMMA has become my best friend
Hmm.
of helping a patient break up the expense of a very expensive like rehabilitation.
Hmm.
And unfortunately the milled PMMA might be too good that like when they say how long is this going to last, I don't really want to give them an honest answer,
Right.
but no, it's definitely like, you can put these things into service for like a year, 2 years,
Yeah.
and like buy the patient time to like make the next financial step.
Yeah.
Um, I think the other thing is when you have your own 5-axis mill, uh, I mean, it's hard to keep your mill. Our mill runs a lot, but it
Yeah.
doesn't run 24 hours a day,
Right.
right? So if I need to spend 2 hours milling an abutment level PMMA, full arch interim
Hmm.
solution, like that's fine.
Sure.
It's not blocking me out from making the crown I need for the next day or
Right.
the onlay or something. So
Right.
so that's like kind of the beauty, and maybe you can be a manufacturing snob when you have like a 5-axis mill just waiting for like the
Yeah.
next project
Well, it's like,
to enter it. So
at the end of the day, here in the private practice world, if that spindle isn't spinning, that machine's not making you money, right? So it's
mhm,
like, if it's down, put it to work,
mhm,
even if it's for milled night guard, like who cares?
yeah,
Like let's get something out of it,
yeah,
you know?
no, totally.
Which is another, you mill night guards quite a bit, right? Still?
Yeah, so that would be, I guess, if that's another example of me being the manufacturing snob.
Right. Yeah.
Is like, well, I have the 5-axis mill. There's this one puck that I just love from Tech.
Mhm. Is it
That's
the flex PMMA?
it isn't that way. It's one that gets like ordered from Germany every time I ask for it. But it's just a clear PMMA, but it's just a specific variety. And I just found like it has like awesome durability and mills really nice.
Nice.
But that is like you can almost mail it to the patient, right? Like if you've done really good jaw relations and everything. But I would also say that was an area where I definitely had the most growth to do is the hyperdent world, the cam world,
Right.
right?
Right.
And thinking like, oh, I'm gonna start manufacturing all my stuff.
Yep.
Like that is an area where like you really need to have like mastery, and even something simple like a night guard have
Right.
like, some higher level challenges cam
Yeah.
wise to get you like consistent results.
Yeah.
And but then once you have that process built,
Right.
you could mail it.
As
So
long as the variables stay the same, you don't change what cutting tools you're using, you don't change what material you're milling,
and
you
you
know,
calibrate your machine.
calibrate your
Yeah.
machine,
Yeah. Yeah.
then you should expect the same outputs. But, um, you know, I think CAM software, Hyperdent, and, other CAM software is something that is underestimated. Like, the importance of it is underestimated a lot in our industry, especially by new users.
Mm.
So unpack that. You made a statement a moment ago of like, it was a lot of learning I had to do there. It was a lot of things like unpack that a bit. Like what are some of the top whatever top three things that you think most people forget or don't realize or underestimate when it comes to CAM software for dentistry?
All right. So I guess when you hear the term, and I'm saying this because I was guilty of this for
Right.
sure. 5-axis mill,
Right.
right? So you just think like, well, the machine can tip and do whatever it needs, and it's gonna like get into all the nooks and crannies and like get it all milled out. And the part on the screen that came from Exocad is the part in my hand leaving the mill, right?
Right.
And it doesn't quite work that way,
Only
unfortunately.
only
But
no
I
trick.
mean, I think it's getting closer all the
Yeah.
time, right? As they add like automation and algorithms to like, find those undercuts and get them for you. But I would say like that's where Imagine's been like instrumental in my journey with Hyperdent,
Mm.
is like learning like, okay, what are the limits of the machine, and like how do you make sure you're not asking it to exceed those limits
Mhm.
for tipping and things like that. But also just the approach in Hyperdent of like identifying the areas that aren't going to mill out unless you like create a custom tool path to do that.
Right.
And that sounds like complicated, but it isn't. It's
Yeah.
just like you just have to know what like buttons to click in Hyperdent to like show me the areas that aren't going to mill, and then
Mhm.
you tell Hyperdent go get those areas,
Yep.
right?
Yep.
But it does require, like being aware of it, and
Some
then
knowledge.
yep, and then also kind of checking that like the solutions, the orientation of your part, that like those are all reachable areas.
Yep.
And so yeah, so even on something as simple as a night guard, we I didn't realize initially it's milling like a 3-axis machine unless I tell it
Yeah.
to do more sophisticated tipping and
Yeah.
searching for those undercuts. So that little like discovery and disruption, like, kind of like disrupted my product briefly,
Right.
and then I reestablished like the settings, and now you're back to like I can mail it to you,
Yeah.
right?
Yeah.
But so anyway, so that's a big part. I think of when we talk about, milling full arch implant interims or definitive restorations, or even things, definitely if you're milling dentures or treatment partials,
Yeah.
like finding undercuts and making sure that those can be milled out. That's like an important part of the cam journey.
Yeah. And one of
And
the most important.
yeah,
I mean, if you get a turnkey solution, assuming you get a turnkey solution from whoever, Imagine or anybody in the market, it's going to define the cutting tools for you. It's going to have the milling strategies and templates already defined and created. So you don't have to worry about that. Which in other industries, you get CAM software, it's like figure out the rest. You pick your tools, you define your strategies, right? So at least for us, all that work is done by the vendor. But even when that's done, you still have to have the diligence and kind of the presence of mind to be like, okay, wait a second, what's not going to be milled out? What in this orientation, what is the machine going to miss unless I tell it to pay specific attention to? You know?
Yeah, and I know, like, people that are big 3D printers are thinking, like, "I don't have to deal with any of that,"
Right.
right?
Right.
Because it all prints,
It's
and
okay.
it
They have to deal with other stuff.
right, so they have to deal with, like, polymerization shrinkage,
Yeah.
right?
Yeah.
And
Yeah.
they
Yeah.
and they have to deal with scarring, on their part, and, like, so there's trade-offs both ways,
Yep.
but,
That's perfect.
I think, in general, I feel like we do a lot with PMMA, and I'm just amazed at, like, the fit that can be achieved when you, like, when you can do that last critical step with Hyperdent to, like, make sure you get the product that Exocad, like, designed for you.
Yeah.
So, yeah.
Yeah. Yep. I agree. Um, so let's see. So we kind of went through a lot of your history, your school, the Navy, stuff like that. You're here in this practice. Um, and one thing that I definitely wanted to bring up and ask you a bit about was something that kind of we worked on together and established whatever that was late last year, late 2025. You took on the role as Imagine's first clinical advisor, which is great to have you on board as part of the company. Um, Tell us a little bit about that. Like what, completely separated from, what you think we want from you or anything like that. Like coming into this, like what are you, in your mind, like what are you hoping to be like, I want to do this with Imagine as their clinical advisor,
Yeah. Well, that's a great question. So, I feel like having been in the military and having a long working relationship with you and your engineers,
Mm,
there's always been like an R&D side, right, of the partnership. And I know that, like, there a lot of military prosthodontists like function in that role for
mhm,
you.
mhm.
And that was just like something I didn't want to lose access to, or like it's like an important part of my practice of dentistry
Right,
that
right.
this like makes me happy is like, okay, well, I'm not just going to do it like I've always done it. I'm
Right.
like always like looking at how it turned out. How can I do it better? And I need like the help
Yeah.
of really smart
Other
engineers.
dental
Yep,
nerds.
and people who can write the template to
Yeah.
mill the
Yeah,
thing I
yeah.
want to mill, or so like process improvement. I feel like to really be engaged in that, I think it's important to be treating patients, but then hooked up with like a company like Imagine, and with like the kind of smart people you have working in Imagine to get that done. So that's just like a really satisfying part of practice.
That closes that loop, right? Because like, integrators like us, which that's from my vantage point, that's what I think of our company as, is we integrate all of this software and hardware and consumables and burrs, and we put all that together into a process that works, and we offer that process to customers, and that's part of how we bring them value, right? But like we don't treat patients, right? We
Mhm.
don't deliver prostheses, we don't do those things. We're not in the clinic, we're not chair side, so to have, from our vantage point, to have a clinical advisor who does that every day, you know, be able to close that loop and come back to us and be like, hey, this would be better if it were like that. Or if we put this little thing here, I'll be able to do this and that'll be great. You
Yeah.
know?
No, totally. I think I was fortunate in that like I could do that with you guys in a military capacity. The military is like such a great environment to like be on that leading edge.
Right.
It's a little harder now because, like, when you're breaking in new workflows,
Hmm.
you kind of need to find success rapidly.
Yeah. Yeah.
So,
Yep.
so anyway, but that is, I think that's always something that I'm like looking forward to working with you guys like more closely in that regard. And then also just the teaching element is
Mm.
it's just it's fun. It's something I've always done. So like approaching it from a standpoint of like just teaching dentistry, right? Like independent of any company, manufacturer, material, right? Just like the principles of dentistry and the principles of a lot of digital dentistry,
Right.
right?
Yeah. Yeah.
And like you guys can provide the platform for me to like participate in those kinds of continuing education
Yep.
events, and just like kind of continue on to like what I got to do in the military of trying to like help young dentists like find their way
Yeah.
and find success in the digital dentistry world.
Yeah.
Just as someone who's like, suffered through the challenges, like both the successes and the failures, and like trying to make it a less I think a more pleasant experience, right,
Yep.
for them on their digital journey.
Yeah.
So
Yeah. Less scary, less obtuse,
mhm,
just
mhm.
more even keeled and easier to navigate.
Totally. And I think that's I appreciate that you guys are Imagine in general is giving me the freedom to try to like build courses
Mm.
that will allow like it isn't sexy to talk about cam, details of cam, right? But it is so critical
Yeah.
to like understand those things because it will like undermine all of the great things you've done
Right.
leading up to the moment you need to mill or print something if you can't like finish that off. So I'm looking forward to trying to build uh, education that's like centered around simple, complex, whatever it is,
Mhm.
patient centered treatment, but like giving the details that like were so painfully discovered,
Yeah.
giving those details to others of like how to go end to end from start to finish and just like get the result you really want.
Yeah.
Um,
Yeah, and
so
even if you're just highlighting the pitfalls, right? Be like, here, everybody gets caught in this trap. Don't do this, do that. You
Yeah,
know?
I think there's I don't the other thing is it's just interesting to me to see the continuing education world,
Mm.
right? That everyone wants to learn, oh, I want to do all on, prosthetics. I want to be involved with everything all on, but like there's so much detail in a single implant
Mm.
in veneers on 7 through 10, 6 through 11, right? Like
Mhm.
the details of doing just like traditional dentistry really well and making it like enjoyable
Right.
because it's predictable and like turns out the way you want it to be.
Yep.
So I'm excited to like try to build that area of continuing education, which I think would be in particular appealing to new dentists, young dentists that want to like start to diversify their practice in the area of prosthodontics and
Yeah.
maybe like don't feel like they want to go to residency, but they still want to like grow in those areas. So
Mhm. Yeah, you were at what was it, the University of Maryland not too long ago talking to a whole bunch of residents?
yeah, so my wife taught at Maryland and
That's
that
right.
kind of like got me just whatever I think in just her travels or her promotions of me I ended up like speaking with the residents, and so that's like one of the greatest like forums I feel like is pros residents
Mhm.
that is like the one of the most rewarding areas to teach because they're eager to like do the new thing to like be part of like the leading edge of like the way we treat patients.
Yeah.
And so I think that's appealing to like teach them both the basics, but also show them how like exocad can like it's such a potent tool.
Mm.
And if they can think of it, they can probably do it
Right.
on that platform. So yeah, so I got to spend a day with Maryland residents
Yeah.
and go over treatment with them. And um
It's probably really invigorating for you too, right? Because it's like, you spend whatever a day or two with whatever a dozen residents who are all fired up about this career and this journey, you
it
probably come out of it a little bit more jazzed up yourself, right?
It is. It also is revealing of like, these younger generations, like they latch on like I learn things too when I go and teach them. But yeah, there's moments where like something seemingly simple, they're like, oh, that's how you do that, right? And you're like, okay, well, if nothing else, I taught them that one simple thing today. But no, I think that's always rewarding. And I think that like the I don't know, kind of the cycle of prosthodontists like they're getting their training and they're eager to take everything that they can get.
Mhm.
And I think like being able to like be a part of their growth and kind of like inspiring them that like, hey, exocad is like this is the tool you will carry with you for the rest of your life, right? And yeah, so it's usually a good fit. They're eager to learn it, and I'm like eager to try to like get them fired up about it.
Yeah.
So
Yeah. Nice. Well, I'm glad you had the opportunity to. I'm sure they're going to have you back at some point in the not too distant future, right?
Yeah, it's I guess it's become an annual
Yeah.
thing. But no, Maryland has an awesome program, so it's easy to like go back there and interact with those residents. Yeah.
Yeah. Yeah. Nice. Well, believe it or not, it's almost out of time here, but I did want to close it out with asking you the same question I ask at the end of every one of these. Dr. Peter Barndt, do you enjoy going to the dentist?
I definitely do not.
You don't?
No, so
Ah.
I'm a terrible dental patient. And I've even yeah, I fail on multiple levels. So one, I'm probably squeamish, even during a cleaning with
Uh-huh.
an ultrasonic working on my teeth.
That's really funny.
And then I even made myself aligners and need to do it again. And started off on the aligner thing, lost a retainer, went off the rails. So yep, I'm a just all around terrible patient myself.
That's
Yep.
wicked funny.
Yep.
Yeah. I'm not the best patient either, but terrible gag reflexes, man. It just doesn't
Well,
bode well.
yeah, I know you're so embedded in the field. It's got to be helping you. Like,
You
no.
know, all right, so I'll tell a story here to emphasize how it's not helping me, right? So my daughter is a dental assistant at this practice not too far from her apartment, and I went there for a cleaning a couple months ago. I think I already told you about this. And her boss, the main doc, comes over and does his look at my mouth, and he says, "Oh, you got something going on the upper posterior back here. You should probably get that taken care of." And in my mind, I'm like, listen, my daughter's already told me about how you guys roll here. I know all you do is take analog impressions. You've only got one intraoral scanner, and all you use for it is Invisalign. I don't think I want you to take care of my tooth. And I kind of said that to him in a nicer way than that. Um, but still, I don't think I made a good impression on him. So I think I know too much, and that kind of gets in my way because anybody else would have been like, "All right, doc, take care of it. I'll make an appointment next week." But here I am several weeks later. I haven't made an appointment yet because I'm like, no, I want somebody who's gonna like give me a same day crown, or at least give me a crown, whatever day or two
Yeah.
later, like you were saying.
Yeah.
You know,
Well, I have good news for you.
oh, do you know a guy?
Vermont Restorative Dentistry is accepting new
There
patients.
we go.
So, yeah. But I mean, probably your fees are going to be slightly elevated. Yeah.
Well, yours will be too.
No. My other question for you though is, do you think that dentist listens to this podcast?
Probably not.
I hope
But
not.
if he
Yeah.
does, Dr. O, I'm sorry. I didn't mean to. It didn't come out, man. Cool. Well, Peter, thank you so much for being on the podcast. I've been wanting to have you on here for a long time. So I'm really glad that we took the time on your day off, no less, to invite me up here to the practice. So thank you very much. And as always, everybody, we appreciate you listening and watching. And if you have any questions or you want to be a guest on the podcast, I'm always happy to hear that. You can shoot me an email at Neal, @imagineusa.com. And I hope to hear from you soon. But aside from that, happy cat camming, everybody. Take care. We'll talk to you next time.